Hello, my name is Felicity Ferguson and I'm one of the Consultant Dermatologists at Guy's and St Thomas's Trust. In this brief video, I'm hoping to share with you some advice that you might find helpful if you are experiencing problems secondary to mask wearing. So, as dermatologists, we first became aware of a problem right at the start of the pandemic when, along with seeing increasing rates of hand dermatitis, staff were coming forward reporting problems secondary to the FFP3 masks. So these are the tight-fitting respirator masks that were needed in intensive care and then for any aerosol generating procedure. Following on from that, we're now seeing far more problems secondary to surgical face mask wearing. And in the main, the problem here has been one of acne and breakouts on the skin under where the mask sits. So first things first, we need to get the basics right. So it's really important that we cleanse our skin regularly to remove dirt and impurities. However, we don't want to do anything that's too damaging or irritant to our skin barrier. So it's important you find a gentle facial cleanser that you can use morning and evening. It's best to use lukewarm water for this because anything too hot or cold can irritate the skin barrier. And then you want to pat your skin dry afterwards. Then you need to find a light moisturiser, something that suits your skin and that you get on with, that you can use after you've washed your face. You can also, of course, use it throughout the day if your skin feels dry or tight. Even if your problem is acne, you still need to find a light moisturiser that you're going to be able to use that's just going to help nourish your skin barrier and help protect it from further insults. It's important that we don't use too many exfoliators, so avoid physical scrubs because they will cause further skin damage and risk making your skin problem worse. If you do want to use a facial exfoliator, it's best to limit this to once a week. Okay, so moving on to maskne. So what other steps can you take if you are experiencing a breakout? So there are now very good topical acne preparations that you can buy from your local chemist or on the high street. And a good starting point is something that contains benzoyl peroxide in the region of 5% would be great. And you can apply that as per the instructions and hopefully that will help things. The other important point is to minimise makeup use. So if you do need to wear makeup, go for something lighter for your skin, something that's described as oil-free is a good starting point. And then do wash it off when you get in the house and you don't need to be wearing it anymore. If you're finding your acne is still persisting despite these measures, then it would be worth thinking about seeing your GP because there are many treatments available for acne now that we can step you up onto that will help. Okay, so FFP3 masks. So the issue with these has been the tight fit. So that causes a lot of mechanical damage to the skin barrier, which results in abrasions and even ulcers forming, particularly over the nasal bridge. So there are some measures that can help with this. So things that we found helped our staff were silicone-based dressings. So a good starting point is something like sil tape, which is an adhesive tape you can cut to size. You can stick it over your nasal bridge, you can stick it across your cheeks. And you can do it yourself. These tapes are quite thin, however, so if you've already experienced skin breakdown, they won't be sufficient on their own. If you are using them, when you've put them on, put your mask on afterwards and then check the fit and make sure you've still got a tight seal. When you go on your break and remove your mask, bear in mind that where the tape has been will have been on the outside as well, so it's considered to be contaminated. So you need to remove that tape when you go on your break and replace it when you come back on before you put your mask on. Then, if you're needing something a bit more cushioning, stick with the silicone-based dressings. You can place that over your nasal bridge for a little bit of additional cushioning. Again, make sure the mask fits properly once you've done that. Some staff members got on better with hydrocolloid dressings. It's important to bear in mind with these adhesive dressings that the adhesive portion itself can cause skin trauma with repeated placement on and then subsequent removal. So you might want to think about getting an adhesive remover if you're finding it difficult to keep taking these dressings on and off. I'm now going to just briefly talk about if you're getting other kinds of skin rashes. So we have seen a lot of eczema type rashes as a result of mask wearing, and if you are experiencing red, itchy, dry, scaly skin, I do think you might benefit from an active treatment to help address this above and beyond moisturisers. And a good starting point for that is something like hydrocortisone 1% cream or ointment. Now this is available to buy over the counter from your chemist, and I would suggest you apply it to the affected area twice a day for 1 to 2 weeks, and that should settle it down. If you're finding the rash is getting worse despite this or not settling down, that would be a good point to see your GP, okay? But you're certainly fine to use it for 1 to 2 weeks, and then you can repeat treatment if you should get further flare-ups. Some people are getting rashes similar to eczema, but they follow more of a seborrheic dermatitis pattern, which effectively is dandruff. So if you're experiencing dandruff of the scalp and are finding you've got red itchy rashes, particularly affecting around the base of your nose and your nasolabial folds, so that track from your nose to your lip, can also involve your eyebrows and the area between your eyebrows. So what's happening here is we have a yeast on our skin, and sometimes our skin mounts an inflammatory response to that yeast, and that presents as seborrheic dermatitis. Another issue I would like to briefly touch on is the ear dermatitis that can result as a consequence of mask wearing. So the elastic straps of some surgical masks can cause trauma and be very uncomfortable behind the ears. And there are a couple of ways around this that you might find helpful. So for starters, you can change to a different surgical mask, so ones which are tie based and you tie at the back of your head just to avoid your ears entirely. And then the other option are headbands and tie backs, so they're knitted or elasticated straps with buttons attached that you can put your ear hoops around at the back of your head, so they don't rest directly against the back of your ears. And there are some helpful websites online that can show you how to make your own if you need that. Of course, we are required to wear masks outside of work if we're using public transport, for example. And at these times, it's good to get a mask that is kinder to your skin and less irritant and causes less friction. So masks that are good for that are cotton-based masks or silk-based masks. They're also a little bit more breathable, so I'd opt for one of those if you can. It's also important to remember that while they are reusable, dirt does build up on them. So don't throw them in the bottom of your bag, keep them in a separate storage compartment that's relatively clean, and make sure you wash them regularly. I recognise that I haven't been able to cover everything, and I would suggest that if you are struggling, that you do speak to your GP or to occupational health for further advice. Thank you.